Good afternoon, everyone, and thank you for joining us. We're going to let everyone continue to log on and get started in just a couple of minutes. Thank you.
I feel like we should be playing elevator music or something in the background. It gets so quiet.
I know. Where's the sound effects?
Well, you can start making noises like you usually do. That'll work out.
Don't tell anybody that. That was just
No one can hear, so you're good.
everybody can hear you. What do we have on here? We're getting there.
Magic.
He's real. Is it live or is it Memorex? Do you remember that? Are you old enough?
I am old enough.
All right, we will go ahead and get started. Hi, everyone. Thank you for joining today's webinar, Healthcare and Cybersecurity, a Risk-Based Approach. Today's program will be presented by Chris Mangano, Strategic Alliance Executive, and Jason Spezzano, Manager of Cyber Advisory in Withum Cyber and Information Security Services team. Before we begin, I have a few notes. Today's materials can be found in the toolbar on the right of your screen and will be distributed to you after the program. Also, at the bottom of the toolbar, you will see a questions box. Feel free to send us your questions during the presentation. We will do our best to address them at the end. There will be 4 polling questions throughout the program. To qualify for CPE credit, you must participate in each poll. CPE certificates will be emailed to you within a few weeks. And finally, once the webinar is over, there will be a pop-up asking you to complete a survey of today's webinar. Please take a moment to complete it. It is our way of being able to provide you with the best and most relevant programs possible. I will now turn it over to Chris and Jason.
All right, thank you, Rachel. So we're going to, Jason and I are going to go off camera, as much as that probably disappoints everyone. We're going to come back on at the end for some hopefully good questions. So let's go ahead and disable that. Are we off? Okay, good. All right, so we're going to get started. As Rachel mentioned, I'm Chris Mangano, and I've been doing this a long time, over 30 years, probably closer to 35 years. I've been in IT management. I've owned, built, managed service providers, and been in the security space now for a little over 12 years. And I'm going to pivot over to Jason. He can do a quick intro and background on himself.
Hi, good afternoon. Jason Spezzano. I'm manager in Withum Cyber Advisory Practice. I am a former Marine Corps officer supporting IT and cyber, and then I've been in industry ever since. So 25 plus years supporting DoD, federal, and defense agencies. I have experience with cybersecurity frameworks and risk assessments, threat assessments, and mitigation strategies. Also a fellow with Cybersecurity Forum Initiative. And I'm fortunate enough, if you're looking at the screen, that Chris's head looks bigger than mine for the first time. So I'm pretty excited about that. So Chris, over to you.
But don't believe that. All right. So just a quick overview. We're here today with all of you in the healthcare space because there's a huge focus on, unfortunately, exploiting the healthcare area by cyber threat actors. Healthcare organizations obviously handle a huge amount of personal identifiable information and protected health information, and the unintentional disclosure of that is critical to try to mitigate and contain within your practice. So brief overview of today's learning objectives. We're going to try to keep this on point, where just explain and understand the current healthcare threats and the general landscape and risks, common challenges and pitfalls. Look at the risk analysis phase, which is, evaluating where you are, where you need to be, and the steps to get there is that last target point. How do you get started? And Rachel mentioned that there's going to be some polling questions involved as well. So Withum's Healthcare Advisory Group provides a wide breadth of support services. You're talking today with Jason and I. We're focused in cybersecurity, so we're not going to go down that full list that you see. But if you folks are familiar with Withum and our background as an advisory practice, there isn't much that we don't cover in the healthcare space, and specifically with cybersecurity. Everything involved in the planning, the implementation, and the ongoing management to mitigate threats is part of what we do. So a little bit about the background and the team, the expertise. We're in every sector you can imagine: defense, financial, energy, healthcare, technology, telecommunications. The team's comprised of internationally, globally recognized experts, Big Four CPA personnel, military personnel, of which Jason is one, federal agencies, higher education. We are admitted routinely as experts for testimony, federal, state, and local courts, and we've rendered services in the advisory space for cybersecurity globally in 71 plus countries. Clients involve small to medium size and enterprise class, and again, in every vertical sector that you can imagine. And some of the services on that right side: board advisory, risk evaluation, fraud protection. Again, not to read everything verbatim, but you need planning, you need implementation, and you need the ongoing monitoring to keep your practice protected. All of what's broken down and listed there involves those different phases. And Jason can speak for a moment regarding the background and expertise of one particular member of our team, one of the partners.
Well, the partner that runs our global practice, Ed Keck, he's a former Big Four, and also former CISO in the banking industry, brings a lot of experience with us. And then also our other partner, Matthew Ferrante, who runs our forensics and e-discovery side. He's a former digital crimes expert during the Clinton administration, working for the Secret Service, and he has done multiple court cases with the whole back end forensic evidence portion, of which we'll mention a little bit when we get to the end of the slide. But and then from that, we've got my counterpart. I'm a military guy. We've got a former Navy, former Army, former another banking CISO is one of my counterparts we work closely with. So just bring a lot of experience. That's it, Chris.
Well-rounded team, guys. So that brings us to our first polling question. I don't know if Jason's reading this. Rachel, did you want to read it?
Sure, I can read it. So what popular condiment was prescribed as medicine for indigestion in the past? Mustard, ketchup, barbecue sauce, or sour cream?
We need the bell chiming now.
Yeah, if you can tell me when the time's up, Rachel, then we can read it, the response.
Okay. I'll leave it up for about 20 more seconds. Reminder to get your votes in to get CPE credit.
Too much time to do search on the web. The answer.
You like our picture? Mushroom ketchup.
All right, about 10 more seconds and I'll close it out. All right, I'm gonna close it out, and here are the results. So it looks like 50% of you voted mustard.
Yeah, so the actual answer is ketchup. It used to be prescribed as drugs. So in 1834, a doctor named John Cook, I don't know if it's Benet or Bennett, he added tomatoes to ketchup, which previously was a concoction of fish or mushrooms, which sounds pretty gross. So they added tomatoes to it, which provided vitamins and antioxidants. And it used to be offered as a recipe for curing indigestion, jaundice, rheumatism, and diarrhea, which it probably gave you instead of curing it. But that's the answer. All right, Chris. Next.
If anybody's an NPR fan and you used to listen to the brothers that I think they were brothers, that used to do the automotive review, that's kind of what you're getting today with Jason and I. So keep that in mind.
All right, so just to start off, cybersecurity is part of our everyday lives, right? So every morning we wake up and chances are we start immediately accessing and consuming information. So we're in an age now where more and more of our lives are connected to the internet. So whether it's personal emails, depending on what you're doing for work, downloading sales reports, paying bills, we're switching devices constantly, at least my family or I am. And we manage both our personal and our work lives now pretty much anywhere. So, oftentimes we talk about cybersecurity and cybercrime, and what comes to mind is like government level type operations, which require high level security, but that's a bit of a misconception. So cybersecurity is for everyone because it can affect our daily lives. So our data regarding security information, health information, our personal information, our financial information, pretty much all of that these days can be accessed in one way, shape, or form via the internet. And so since 2020, with the increase of remote work, obviously that's the rise of the pandemic, businesses continue to expand their digital footprints. There's been a corresponding increase in cybercrime activity, whether it's what we call script kiddies. There are also more organized crime groups. So cyber incidents aren't just focused on one industry anymore or one market vertical. They're across industries and really across devices. Cyber criminals today are creative, they're resourceful, and they go to great lengths to get information if it's going to provide them gain. We'll talk about more about the types of information and the value, particularly to healthcare. And it has become a business. Nation state actors today have criminal syndicates. So these are groups of threat actors that have common interests. And they have something called access brokers, which is an underground business model that provide access to a service. That information, once they get access to it, is sold to cyber criminals so they can exploit it. And so they sell direct access to criminal networks. And so bottom line is, you can look on the bottom right-hand light, little box there, the type of information we access and to our kids on a daily basis, and we're online all the time. Next slide. So what we have here is highlighted some notable and some non-notable. Non-notable meaning you won't see it on the news heavily. Breaches over the past 3 years, and this is non-exhaustive. If you did a search, you can find many more. But ones of note that if you've been paying attention to the cyber side of the house, probably you're familiar with it. Solar winds, and I won't touch upon all of these, highlight on a few of them. 18,000 of the 33,000 Orion customers were affected by a threat actor group called Nibelium. Zoom, so when COVID-19 came aboard, there was an explosion of Zoom, and they had a data breach that saw cyber criminals make off with login credentials of over 500,000 users, notwithstanding the fact that they had challenges with data traversing China at the time. Marriott, which Marriott's had a bit of a challenge over the past 4 years, but in March of 2020, huge data breach which compromised over 5 million hotel guests and their personal information. 2021, Acer, electronics manufacturer, some of our families have their laptops. This was leading to the largest ransomware in history called Rebel, which is ransomware evil. Facebook, social media, 530 million users over 106 countries. And Kaseya, which Chris, you can add at the end of this when I'm done as well. Again, Rebel, the ransomware evil, it's an IT network management software that is delivered via managed service providers. And it provided ransomware to around 1,500 small and medium-sized businesses. And Chris, this was familiar to you as well, right?
Absolutely. Yeah. Kaseya, just for those of you who don't know, if you partner with an outside managed IT company, whether you do it internally with your own staff member, or a lot of you probably have an outside managed service provider, an MSP, doing day-to-day administration, system updates, help desk, patch management, they use a platform like Kaseya or Kaseya itself, and that's a gateway into your environment. And that was a particularly nefarious compromise, because you would trust your IT partner to be protected, but the hackers and bad actors are clever, and they've developed ways to compromise even platforms such as Kaseya. So back to you, Jason.
Yeah, and the bottom half, we got Marriott come up in 2022, U.S. Department of Education, specifically New York. Lots of student information was, I guess, pilfered and made available to threat actors. And Uber, which has been in the news, affected lots of users. And, the intent of the top portion is really to let you know, if you look at the different industries, whether it's solar, winds, social media, hotels, electronic devices, gaming systems, crypto, education, again, getting a ride on on Uber, incidents are across industries and devices. And today we're specifically talking about healthcare, and I poached specifically some breaches I wanted to highlight happened this year on related to healthcare. So Shield Health Medical Group, this is around March, June timeframe of this year. It's Massachusetts-based healthcare company. About 2 million people affected. Social Security, patient IDs, home addresses, treatment info. This led to a class action lawsuit. Common Spirit Healthcare. This is one that happened this month, October. They support 140 hospitals, over 2,000 healthcare sites across 21 states. And they had to shut down health records and other systems after they found out they had ransomware. And this one impacted operations, the ability to schedule appointments. They had to do hand record keeping, wait times for x-rays. They gave one example when I was reading the information about it, where a gentleman was getting ready to have surgery the next day, and he needed an x-ray for a hip replacement. And he was concerned about even having surgery given all these problems. So this leads to secondary and sometimes tertiary effects. And then Yuma, that was April of this year, just under 1 million patients impacted. They were down for 4 days. They gained access to systems prior to them being encrypted, and data was exfiltrated, and it was problematic because all their MyCare online sites were all taken down, and they ignored email requests for days, and that impacts healthcare. On the right side is more of your smaller size organizations. So item of note, I looked on the Bureau of Labor and Statistics, and assuming that I looked at all the information accurately, there was a lot of data. 99% of healthcare organizations are small business. And in this case, I just started 500 employees or less. So you may think that many of the high profile cyber attacks target large hospitals and health systems, and they do. But the solo practitioners and smaller practices, just because you're small doesn't mean you won't be a target. In fact, 71% of ransomware attacks targeted small to medium-sized businesses. And this was according to Health IT Security study that was done for this year. So we mentioned physician business offices there. It's at Parkersburg, West Virginia. They had a security incident in April, about 200,000 users, and files were present on compromised system, and significant PHI data was released. It even had diagnosis information, disability codes, prescription information, health insurance information, and we'll talk about the types of data here shortly. And then just one last one, so we move on to the next slide. Aesthetic dermatology, that actually was last month in August, 2 months ago. I know my months. An unauthorized actor got access to systems which housed information, PHI data. So this was like names, addresses, date of birth, diagnosis codes, additional health insurance information. And this information that criminal actors, and we'll talk about this more, is value to them. And we'll start pivoting after some more statistics as to why healthcare is such a largely targeted industry. Next slide. So all this data on this slide was pulled directly from HHS, Office of Civil Rights. So I took all their breach data, I think this was mid-September timeframe, and I just racked and stacked it and sorted it because I wanted to see kind of how it panned out. 70% of it were healthcare providers. On the opposite side are business associates. It was 70%, but I want you to look at the average number of users impacted. While business associates were only 17%, the average amount of users impacted per breach, and this is just the average that was listed on there, was 162,000. So they got more bang for their buck going with the smaller organizations that had business associate relationships with providers. And in addition, if you look at the box below it, the data breaches that are reported, 500 and more from 2009 to 2021. I think they show there about 4,500, just under 4,500 data breaches, and that equates to about over 300 million healthcare records, I think, that were breached. Between 2020 and 2021, about a 40% increase in breaches, and 2022 is on track to exceed even that. The interesting thing of note is less than 1% of breaches that are reported that impact 500 patient records or more. So in terms of the number of breaches, this is just what's reported. There's more out there. And the other thing I would note is 60 to 80% of total breaches in general go unreported. So that's a lot of breaches that we don't really know the total size of related to the impact of healthcare, but that's only going up. So next slide. And we have our next polling question. Rachel, over to you.
Thank you. Who were the high heels originally invented for? French designers for fashion, Queen Elizabeth, soldiers, or farmers? Reminder to keep putting your votes in. Leave it up for about 30 more seconds. All right, about 10 more seconds and I will close it out. All right, I'm going to close it out, and here are the results. So the majority voted Queen Elizabeth.
That makes sense. I understand why it would be said that. Actually, this was originally invented, high heels, for soldiers. So it's traced back to 15th century Persia, and it was done so they could secure their feet in the stirrups, which makes sense after you say it, right? Eventually, the shoe trend went to Europe, and actually male aristocrats used to appear taller and more formidable. So it wasn't until down the line that the trend caught on, with women. So it was originally done for soldiers. Interesting bit of trivia. Next slide. Okay, so as we look at cybersecurity and healthcare, 93% of healthcare organizations experience a breach. And if I take that to the far other side, the other red box, 50% of healthcare organizations, once they get breached, particularly with ransomware, they're likely to get breached again. And 50% of them got breached greater than 5 times, right? That's not all in 1 year, but over time, they've experienced over 5 breaches. When you look at the middle boxes, the healthcare industry is the largest nation's, accounts for 20% of the nation's gross domestic product, right? That's about $4 trillion of US GDP. And this is according to the Centers of Medicare and Medicaid Services. So that's projected just to go up. When you juxtapose that on the spend for cyber, which doesn't really juxtapose, but when you look at an IT budget, 4 to 7% of healthcare systems IT budget is in cybersecurity. Compare that to about 15%, which are other sectors, such as financial industry. So cyber hygiene, so these are the practices that you do to protect your information. It's a notable challenge. Outdated IT systems, and you guys in this space know this, particularly with third-party systems that you have contracts with, regular patching, qualified cyber staff, those are challenges. And as a result, kind of the formula for threat actors is, given who they go after with limited effort expended because of the challenges, it's significant reward. And we'll talk more about why that is, given the type of data they're able to pull in. And so to exacerbate this issue, healthcare industry has been under, particularly the past 2 years from the pandemic, immense pressures, right? And then the value of the data for threat actors compared to repercussions for healthcare industries and the continued challenges for putting an appropriate protection, make it a target of opportunity. So what's interesting is 80% of healthcare businesses paid a ransomware after it, or 80% of businesses after it was under a ransomware attack suffered a second attack. And of those, 46% believed it came from the same group who did it the first time. And this information came from the Ponymon Institute done in conjunction with IBM. Next slide. So when you look at cyber attacks, I'm going to breeze through a couple of these slides so I can get to kind of the value of the data. And I'm trying to make sure I'm keeping on track here. Is a study by Healthcare Information Management System Services, HIMSS, in 2022 State of Healthcare, looked at healthcare practices, SMBs. 20% of those felt the cyber attack dealt with monetary loss, which seemed a little bit low to me, but nonetheless, that's what the study purported. From an organizational perspective, healthcare brands, are built on an image of safety and protection because they take care of people. According to the respondents, so these are the actual organizations themselves, 50% didn't feel that they would recover from a cyber attack. 28% said it disrupted their IT operations, and 27% claimed that it disrupted their ability to do business. And it also impacts people, right? So people, if their personal information gets taken, their finances, their physical well-being can be impacted. So if a hospital closes its doors, or it impacts the ability to assign rooms or schedule surgeries, or even impacts productivity, that's a challenge to the healthcare they receive. And approximately 50% of the data breach victims, they reported that they suffered, stress from it, right? Those that went through identity theft, their average out-of-pocket was $2,500 per patient, and it gave them, in some cases, physical, but mental stress in having to deal with it. So next slide. Why are healthcare organizations rich and more easily susceptible to cyber attacks? The first thing, we've alluded to it a little bit, is it's easier. We have a lot more interconnected devices and systems. The need, particularly with, under the Obama administration with the HITECH Act that came out, we have a lot more information sharing, not only across devices, but among third parties and just information sharing. We have outdated and unsupported software. I recently did a penetration test on a major healthcare system, and we found over 1,000 findings, of which over 300 were considered critical. 551 systems had unsupported operating systems or software. And when we talked to them about it, they said, well, it's easier said than done to fix it. And they pointed to the third-party contracts. I'm not picking on GE, but GE came to mind, right? If they have a contract in support of a system that's provided to a healthcare industry, they felt they're beholden to them to do all the updates. But if they're bringing risk into your environment, it's your risk, and you have a say in their ability to fix it. And there's going to be legislation coming forward, particularly around healthcare devices and systems, and more coming, according to a report this week from the administration, that's going to impact healthcare. And so typically, if there's a breach that happened, whether it's unpatched systems or delayed, it's about 6 months before it's identified. And the irony here is everyone, and I mean everyone, is invested in healthcare. Everybody needs a doctor. Everybody needs a physician. We all need access to a hospital at some point in our life, and everyone's involved in it, and it's a challenge, right? So whether it's health records have a longer shelf life. If it's a credit card and something happens, you're able to shut it off or get a new one. And it may still have your information, but you're able to take action and it stops. A little more difficult with respect to a health record. You can't just change it or block it against further use. In some cases, it can take a long time to secure if it's compromised. In some cases, it's not. HIPAA retention records, right? You need to keep them for 6 years. Federal law, I guess, for medical records, the retention is 7 years, but state laws differ. Like in Massachusetts, you need to maintain medical records 30 years after your patient is discharged. New Jersey, Florida, Illinois, it's 10 years after discharge. Texas, 7, Florida, 5. You know, it's different in many cases. The value of a health record. A medical record worth 10 times more than a credit card number. That's an attractive for a cyber attacker, and we'll talk about that in the next slide. And if you lose IT systems, it impacts lives, right? In some cases, it could be a matter of life and death, and it makes hospitals susceptible to wanting to pay their ransomware because, you know, they have lives on the line. And the other is the increase in remote access systems and tools, such as telemedicine, remote patient monitoring, wearables, medical systems, data sharing. What's interesting is I think Gen Z and millennials use remote access methods for healthcare and increase cloud-based apps more than any other age group. Next slide. So why are medical records so attractive? It includes lots of information, right? PHI, if a criminal has access to it, they can create a complete identity of a person. They can sell it in whole or they can sell it in part. And on the bottom, you can see the various aspects that this information could be sold off for. Data laundering, and this isn't even exhaustive. There's more uses of it. Data laundering, so you can sell PHI data. You can use it for health insurance fraud, so entire record can be used for medical care. All bills are sent to an insurance company and no one's aware of the fraud. You could potentially use it for drug abuse. It could be used for prescription pain meds, which is a controlled substance. It can be used for credit card fraud if they gathered your information, or it could be used, you know, threat actors for a breach list. This information via data dump can be sold on the dark web. And you can take a look at these breached information online. In some cases, I can get passwords along with the login username. And that's usually the first from the intelligence analysis a threat actor does. He'll look at breach lists first and they'll try those. And chances are, if it's a current login, they use a technique called password spraying. Most people use their password more than once for more than one system. So they have the ability to log into multiple systems. But once they're in, they'll actually escalate your credentials to gain access to further systems. So bottom line is, this information is worth a lot. Typically, PII, just your name, address, and maybe social security information is about $180 per record. PHI, it varies, but on average, it's about $250 per record, and that's a conservative number. So you can imagine if someone breaches and gets, say, 100 million records at a million records at $250 a pop for a threat actor, that's worth a good bit of money. Next slide. Another polling question. Rachel?
Thank you. Our third polling question: which one of the American presidents was also a wrestling champion? Grant, Lincoln, Garfield, or Hayes?
And they all have beards, so that's one of the reasons why I chose it.
I'll leave it up for 30 more seconds. Ten more seconds and I'll close it out. All right. It looks like for our results, tied between Grant and Lincoln.
Oh, that one's so close. So the correct answer is Abraham Lincoln. So as the legend goes, Abraham Lincoln only lost one match out of what is told 300, right? So he was a wrestling champion in his county. I'm not so sure how that worked back then, but at the age of 21, he was a wrestling champion. And some of his well-known matches, he used to throw hijackers overboard from a Step Brothers river barge when he was younger. And at 19, he beat the county wrestling champion when he was challenged to compete. And I guess through lots of different bouts, as noted, he only lost one. So next slide. So why does the healthcare industry struggle with cyber? So as I noted earlier, I've done risk assessments for physicians' practices, in some cases, some healthcare systems. And I talked about cyber hygiene earlier. This is, what you do to protect your information. The basics, what I call the basic blocking and tackling, is difficult, not for everybody, but in most. And smaller organizations in particular, because it requires an investment. But default or anonymous passwords are a common thing we find, right? You have a device, it comes with a default password, those aren't changed. We find a lack of training of employees. You can be successful 99% of your time, but one employee provides access, and that's kind of the front door letting someone in through a phishing attack. So training your employees is critical. Failure to update software and third-party systems is critical. Patching, threat actors, what's called a 0 day, meaning something that's brand new and out in the open, a vulnerability. They're sophisticated threat actors can exploit it with about a week from it being known. Best practice, organizations that have their stuff together typically patch once a month, and that's not even sufficient, and we find it in many cases worse. Configuration management, with a HIPAA requirement, encryption of data, we find a lot of it's not. Data loss prevention software, so if you have data like PHI records that's able to be accessed, do you have restrictions that it can't be pulled out of your environment? That's called data loss prevention software. Most cases, that's not the case. Or is your network created in such a way that if an attacker gets in, it limits what they can access to? That's called network segmentation. Most networks are not created that way. So the only point is, a lot of these things just require focused attention, and it's a challenge in the healthcare profession. I mentioned a lot of it, medical devices, mobile applications, more need to access data remotely, a lack of in-house expertise. A lot of times we have IT expertise, but we don't have cyber expertise, and it's different. Third-party vendor risk management. We all live in an environment where data is shared with entities that we do business with. Could be a managed service provider, If they store, receive, or access PHI information, they need to be a business associate. And that's per HHS, right? Or we have business associates that require minimum contract requirements to make sure you're able to take a look at the controls they have in place and take a look at their audits in order to manage your risk. But third-party risk management is more and more a big issue for everybody. We talked about training, and the other one, which kind of segues into some key portions of the presentation, is limited or no risk management. Now, what do I mean by that? Next slide. So if you look at the HIPAA safeguards, so it's 45 Code of Federal Relations, 45 CFR 164-308. I don't expect you to remember that. It essentially is the HIPAA safeguards, right? As part of the administrative safeguards, the first aspect that you're required to do is security management, which is a risk analysis phase. Failure to do this can be costly, and many people, when they do a risk analysis, and I've seen it, they'll do a penetration test, understand their threats and vulnerabilities from a cyber perspective, which is good. It will help identify controls that are in place or not in place, or if they're effective, it will work. But what's required under a risk analysis phase is to get a good understanding of what are your major systems that help you operate your business day to day, whether it's an X-ray system, or you're dealing with cancer and blood research. Whatever those critical systems are, help you operate your business day to day. What are the threats and vulnerabilities to those systems? And if they go down, how does it impact your business? Can you be down 1 hour, 2 hours, 4 hours? But going through that is foundational to your business continuity and your backup and recovery strategy. Once you understand those critical systems, you calculate what's the probability of the likelihood of that system going down and the likelihood of it occurring. What are the threats to it? That allows you to prioritize your systems, the assets that support, in this case, like servers, desktops, devices that are connected, and the processes. Again, that helps for your basis for your continuity and recovery strategies. Once you identify that, there are minimum controls required outside this phase in the HIPAA safeguards, but it helps you overlay additional controls to manage the risk that you've identified. Once you've identified additional controls to protect the systems, if I have certain critical systems that help me do X-ray or cancer research, well, that goes into my strategy to say creating a network segmentation so that if someone gets in, it's more isolated. That's an example. Then I can create a method of monitoring my critical assets and continually assessing the risks. And this information is documented. It goes into what's called a risk assessment report, which can be presented to the board so they understand cyber as an enterprise risk management vernacular, that is vernacular or discussion topic that they understand, and you can allocate resources and prioritize your systems accordingly. This is the foundational part of the administrative safeguards. It takes time, and the people, the operational folks who do this are part of the process. It's not done just by IT or cyber or your compliance officer. It requires everybody to be involved, and there's value in doing so, right? So if I go to the next slide. Right, so the benefits of doing this are, one, long-term cost reduction, right? So everyone's a part of it. So the early identification and prevention of these risks in your organization can reduce operational costs, right? Because if you, for example, if I restore or restructure my IT infrastructure, it's much more costly than if I developed preventative measures against threats or outages, or put mitigations in place beforehand so I can minimize the impact. And strong controls help drive more consistent processes and ultimately higher quality and the ability to continue operations for your patients. And then it provides a template for future assessments. The first time you do it is the most challenging because it requires the most effort. But once you've done a formal cyber risk assessment and your analysis, it makes it easier to repeat the process because you've already done it. Your personnel have firsthand knowledge of the concepts, they understand the tools, the templates, and it helps streamline it as you continually update it. And it provides the next point, awareness to your organization. You identify vulnerabilities and attack vectors and allows you to complete the security picture and promulgate that information to your leadership up in appropriate things and provide training and communication to the organization downward. Ultimately, it helps prevent data loss, breaches, and regulatory fines. And what I mean by that is a risk analysis leads to stronger risk management, which helps prevent threats from happening. It won't stop it, but what it does do is when it does happen, you have a process in place to minimize the consequences or impact. And if you, when an incident happens, everything becomes bare. And an auditor or a regulator, when they come in and see that, or a federal agency, they'll know what you did, what you didn't do. If you did what you said, the impact from a regulatory standpoint is less because guess what? Threat actors are sophisticated, they're gonna get in, but you want the ability to mitigate it and then adjudicate that risk and continue operations. Next slide. Our last polling question, Rachel.
Okay, our fourth and final polling question. Which bone are babies born without? Spine, skull, the frontal bone, kneecap, or femur?
I would hope most of you would know this one better than I did, because I did not.
I'm gonna leave it up for 30 more seconds. About 10 more seconds and I will close it out. All right, and here are the results. The majority voted for the skull frontal bone.
Yes, that one makes absolute sense, but it's not the skull. So obviously within the skull, there's gaps between the bones that make up your skull. I think the fontanelle, and I'm not a doctor, right? Nor do I pretend to be one, but it's actually the kneecap. So patella is made of cartilage, but that slowly stiffens and turns into bone, a process known as ossification. So kneecap. Someone could probably argue that with me, but that is the answer. Next slide. So what if your practice or your healthcare entity gets hacked, right? So first is don't be caught unprepared. You want to make sure you practice and review your incident response plan. And I would add to that with an annual tabletop exercise, which most don't think about. It helps you run through your incident response plan, simulate it, understand where the gaps are, both in who does what, but also your communication strategy. And if you don't have a plan, this is a requirement under HIPAA. And if you don't know how to do it, you know, then organizations such as Withum can help. So an incident response plan, basically it's a set of instructions for IT or cyber staff to help you respond to and recover from incidents. It helps you outline the types of incidents and how to address issues like cybercrime, data loss, service outages that threaten your work. The risk analysis phase is very helpful here because that continuity and recovery portion, it helps identify the priorities if an incident happens. The ironic statistic here is from a small business perspective, 31% of small businesses have an incident response plan in place. So if something happens, they'll defer to their managed service provider, and in many cases, they may not have one. or another entity to help them. So it's really helpful to have one in place. Second one, and I'll try to go through these high level, preserve evidence. Take the proper steps involving the right people so you don't inadvertently destroy valuable forensic data used by investigators to determine how a breach occurred. Having forensic support available is an important action, and getting them involved before you direct certain things to happen, even if it's your managed service provider, is appropriate. Containing the breach, you want to begin by isolating the affected system. Process should be outlined in your incident response plan, but it helps you prevent further damage until that forensic investigator can walk you through kind of a more complex and long-term containment approach. And then I won't go in detail on the aspect of containment. And you want to make sure you implement and start your incident response management portion. So into your incident response plan should be members included in your incident response team. And a data breach is managed through teamwork, not individuals. You want to get your team together. Hopefully you've already met, you know who has what role. And that's where the tabletop exercise comes in. You work through this, and you should have like a team leader, a lead investigator who is in charge of communications, who's your C-suite representative, office representative, legal, public relations. All these things are important. And then there's appropriate breach notification requirements, not only communication to individuals affected, but HHS and in some cases agencies. So investigate and fix your systems. You know, management of a data breach doesn't end when you release kind of your public statement. The hardest part is at the end, right? You investigate and you got to fix stuff, right? A forensic investigator, if you have them involved up front, they can be very helpful in helping you understand what recommendations or how you repair the environment to ensure it kind of mitigates this happening again. Next slide. So how do you get started if you don't have any of this? So the requirements under the HIPAA safeguards, you have to have someone assigned for security. Smaller organizations, a lot of this time, this becomes a collateral duty. But the challenge in that is if you don't have security experience, you know, make sure you get someone on board to help advise you or appropriate actions and pull this stuff together. Develop your security policies and procedures. If you don't have it written down, it begs the question on what you're protecting and how you're doing it. And it's a requirement to have your policies and procedures in place. We talked about the importance of training. If your workers don't understand what a phishing attack looks like, they'll click on pretty much anything. And once one gets in the door, that's a challenge because it's harder to get it out. Do a gap analysis and risk analysis. We talked about the importance of it. Not only does it give you an understanding of where you are in HIPAA compliance, but it gives you an understanding of your operational risk and the impact of operations to your patients. And then the third one, the last one, the fifth one here, is making sure your third parties, business associates, and all your contractors and vendors have been looked at on the type of data they receive. And if they require business associate agreements, make sure they're in place. Make sure the contract terms have appropriate minimum security controls in place. And then make sure there's an ongoing battle rhythm to provide oversight to make sure you're managing their risk. If they have a data breach with your data, it's your breach, not theirs. And you can't transfer risk. Ultimately, you're responsible for your third parties within reason. So Chris, I'll hand this over to you to take on next steps.
Sure. Okay. So Jason, thank you. We appreciate great insight. And guys, just a wrap up comment here on this particular slide. You know, for those of you that are obviously practice leaders, administrators for your organization, trying to get your head wrapped around where do I go? What are the steps? We've laid them out, but you know, a lot of organizations inappropriately develop a false sense of security, pun intended, engaging in-house IT or a managed service provider that's doing the day-to-day system administration and maintenance of your IT infrastructure And you cannot really do that effectively. You can't commingle those tasks. So, if you have IT, whether inside or outside, that's designed a security posture involving, your perimeter, the fox can't watch the hen house. There has to be some independence there. You're not going to be able to objectively evaluate your security posture. So partnering with an organization that specializes in risk analysis and does the work up front, implements the controls, policies, and procedures, and does the long-term monitoring is critical. So this involves a cybersecurity assessment. It's a risk review. The pieces to that involve a penetration test, internal and external. The deliverable that you receive is comprehensive, and it identifies a clear picture of where you are today, where you need to be down the road, and what's the best way to get there. We provide a blueprint and a step-by-step progression, so you're not throwing good money after bad. Okay, there are a lot of things that are happening right now in the cyber landscape, and a lot of the practices that we are working with are actually engaging and getting their cyber posture improved because of cybersecurity insurance. A lot of underwriters are getting a very honed view of the risk, and what used to cost $5, $6, $7, $10,000 for a cyber insurance policy literally is 5 to 10 times that amount. And for those of you that engage and work with your broker that are on the call now, you know what I'm talking about. So, these are important times, and getting a handle on cyber threat management is definitely something that you need to do, not just to protect the data, but to ensure that your practice is going to be around tomorrow to continue to do the work that you do. So our contact information is up. Jason's contact information, my contact information. If anybody wants to have a continued, conversation, reach out. If we have any questions at this point, I don't know, Rachel can step in and let us know. We're happy to answer any questions.
Sure. So we just had one come in, and everyone feel free to take the last few minutes to send in any other questions you may have. Someone had asked if we have an example of a healthcare risk assessment or any sample templates that are good to use.
We do have. Go ahead, Jason.
No, it's short answer is yes. There's different components that kind of walks the dog through the process. So under the risk analysis phase, that first portion of identifying critical systems and then identifying the probability of impact, that's what I call a business impact analysis. And there's kind of a walk the dog approach on identifying those and moving on to the next phase. And believe it or not, at least that portion of it, there's a lot of good templates that are open source that you can find, but we also have that in place. So short answer is yes. Chris, did you want to add to that?
No, that's exactly where I was going with this. I mean, there are frameworks out there, templates, policies. Your internal controls, policies, procedures are mapped out, resulting from the initial analysis and evaluation of your current risk posture, which comes from a cybersecurity assessment. So, if you look, obviously there's a ton of stuff online. A lot of things are free. I mean, you can do template downloads, but the key is to be able to do what's appropriate for your particular practice. Jason alluded earlier on to, your particular delivery. What area do you specialize in? What tools do you use? What applications are in place? And where are those particular vulnerabilities? Isolating them, correcting them, and then maintaining a mitigation strategy is crucial. And a lot of people, in the physician space, healthcare space, small practice space, believe that EMR, EHR takes them out of harm's way, and that's just not the case. You cannot transfer risk. If you host a platform and it's co-located, it's in the cloud, and there's an incident, it does come back to you. What steps did you take to make sure, that you were attempting best effort to align with what you were expected to do?
We just got one other question, probably our last one, just be mindful of everyone's time. When should the board of directors be contacted about an attack?
Great question. So under HIPAA, Jason, there are mandatory report outs, and I think they may vary by state.
Yeah, so I mean, once you have an understanding of the impact on the organization, and even if you don't, the board should be advised on what's happening and update it as it's progressing. What you don't want is if you report a breach to HHS and you're listed under investigation, which I think automatically happens if it's over 500, ultimately that under investigation at some point a resolution will happen, and then that'll roll up at the end of the year and get reported to Congress with the organization's name on it. If they come knocking on the door, your board needs to make sure that they understand what happened, how it happened, and how you addressed it. They don't need to know the details. They need to understand the risk and how you addressed it appropriately, because it shows that they were involved and were part of the oversight and assurance aspects of it. And so, you know, nothing gets better with time. So the early that they know about it and keeping them appraised, that's appropriate, particularly if additional resources are going to go. And you know, these potentially have regulatory, reputational impacts and potential legal impacts upon your organization. So not keeping them involved is problematic. If you've been in this space for a while, and you all have been, in some cases, organizations don't really have a security culture, and they'll try to not let the board know out of fear of repercussions. You know, buckle your chin strap, keep them involved, because if you don't, it's far worse. So hopefully I answered the question.
Rachel?
Yep, that is it. So thank you everyone for joining. As a reminder, please take the survey at the end of the webinar, and we will distribute the webinar recording and the slideshow as well.
And Rachel, if I could just add, if anyone has any questions that weren't answered or you're curious, feel free to email Chris or I, and we'll be glad to follow up with you.
Right. Thank you, everybody.